The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. Our topic for the podcast today: we are approaching the Medicare Advantage open enrollment season in October, and many are asking what will happen in the program in terms of benefits, products, and geography because of insurers' financial meltdown, especially due to MA. It is a good question given all of the member impacts we saw in 2025 when major players and others significantly contracted or exited the program. We will take our regular 3 breaks today, so let's get right into this very beefy subject. Let's start out by saying that MA is growing overall, and that will probably remain the case. The question is, how much will it grow due to the financial mess? A few statistics here. Since January 2020, MA enrollment has grown from 23.93 million to 35.44 million in July of 2025, a growth of 11.51 million. From January 2020 to January 24, average growth was 10%, ranging from 6% to 11%. Growth from January 24 to February 25, however, did come down considerably to 4.4%. Since February, though, MA continues to grow at a healthy pace overall. Between February and July, almost 500,000 lives were added to the MA rolls. But MA has been in financial distress of late. Why? Well, there are a few reasons. There was a new risk adjustment model, V28, that started to be implemented in 2024 and will be complete by 2026. That will take more than 7% of revenue out of rates annually when fully implemented. Star performance has been successively lower since 2022, and that has meant billions in less bonus revenue to plans. Prior authorization reform in 2024 has meant higher medical costs for MA plans. Medical costs and utilization have been higher coming out of the COVID pandemic. And rate increases in 24 and 25 were negative, including the V28 impact. In 26, it will be about 5%, but utilization and spending may increase as much as 9%. That's huge. So what will happen? We are likely in store for a rate of growth from 25 to 26 that is similar to 2024 to 2025. It is clear that the major retrenchment by MA plans in 25 impacted overall growth. We will discuss the retrenchment in 2025 next. But the program will grow just the same given the significant advantages for plans and beneficiaries, even with further big MA contraction if that were to occur. MA plans still are able to increase benefits and make products appealing for a few reasons. MA rate setting largely is based on the antiquated and inefficient fee-for-service programs costs. This allows plans to deliver base services far more efficiently and pass savings on to members in additional benefits above and beyond fee-for-service. These savings are mandated to be passed through to member benefits. Plans do a variety of things with the money. They reduce traditional program cost sharing, which can be very high in places. The plans fill in huge fee-for-service program benefit gaps, such as high costs of the inpatient benefit and the cap on covered days. These often bankrupt seniors and people with disabilities if they are in the fee-for-service program. Plans also add numerous supplemental benefits not found in fee-for-service. The other reason plans do really well in MA are the Star Quality Bonus Program rewards high-performing plans with additional revenue to augment benefits even more. MA plans also are improving outcomes where fee-for-service is failing miserably and providing critical services such as case and disease management. The combination of the benefits and quality focus again makes for a great value proposition. MA has become one of the greatest social safety nets for lower and lower middle income seniors. It can mean hundreds and sometimes thousands of dollars a year in additional support to fixed income Americans. The value proposition means members flock to MA, and savvy Medicare beneficiaries are also moving to the highest performing plans from lesser rated ones to get added benefits and better quality. With that, we will take our first break, and when we come back, we will discuss what retrenchment happened in 2025. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this edition of the Healthcare Labyrinth Podcast. We're talking about what may happen in 2026 to MA benefits, growth, and more. So what happened in 2025 from a benefits and retrenchment perspective? Generally, 2025 brought a reduction in some added benefits, a major contraction of the preferred provider organization product, and geographic contraction. While many plans pulled back, national MA plans struggled the most. Big MA plan enrollment, again, rose from 25.568 in January 24 to 26.348 million in February 2025, an increase of 780,000 or 3.1%. But this is down from 2.111 million or 9% from 23 to 24. What's worse is big plan MA enrollment went up just 16,100 from December 24 to February 25 due to the contraction in benefits, products, and geographies for 2025. Many plans across the spectrum had to reduce their benefits, products, and geographies. But it is true that big plan MA did it the most because of their significant financial miscalculations. Non-big MA plan enrollment grew at a healthy pace year over year as well, about 688,000 or 8.7% from January 24 to February 25. The growth compares favorably to the prior year-over-year statistics for non-big MA plans, about 563,000 or 7.7%. Non-big MA grew about 406,000 during the enrollment season, about 5%, while big MA again was basically flat. Big plan MA enrollment represented about 76.38% in January 2024 and is about 75.41% as of February 25, down by about 1%. Big MA enrollment continues to struggle, with big MA penetration failing slightly more so thus far in 2025. So again, the biggest contractions happen for big MA plans, and I'm going to tell you a little more about it. Humana and CVS Health's Aetna did contract their benefits, products, and footprint rather dramatically for 2025. From January 24 to February 25, Humana dropped by about 404,000. Its benefit and product changes forced over 500,000 to move to new plans. Aetna dropped by 253,000 from January 24 to February 25. Its changes forced 450,000 to find new plans. Centene also contracted in the time frame by 69,000. United too reduced offerings in 2025, except not to the extent that Humana and Aetna did. About 250,000 had to find new plans, although United grew from 24 to 25. More broadly, over 18 organizations left MA in 2025, including a few prominent Blues. But this impacted only about 1% of enrollment. Approximately 1.3 million members had to find new PPO plans in 2025 because their plan was sunset, while about 530,000 members in HMOs had to find new plans. Firms put the number of people impacted by plan terminations or exits at between 1.8 million and 2 million enrollees. In the average year, the impact might be less than 100,000 people needing to change because their plan or product is going away. So what have we learned here? Again, there was significant retrenchment in terms of benefits, geographies, and products in 2025. But most of that retrenchment occurred with the big national plans in financial distress. Still in all, the number of people impacted by having to find a new plan in 25 was very significant, somewhere around 20 times more than it normally is. With that, we will take our second break, and when we come back, we will discuss more about the 2025 retrenchment. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We're talking about what may happen in 2026 to MA benefits, growth, and more. I promised some additional stats about the 2025 benefit contraction. So here are a few stats. The overall number of plan benefit packages, PBPs are what you would think of as a benefit plan, dropped from 7,289 to 7,127, or 162 PBPs on a net basis. That's a drop of 2.2% of those benefit offerings overall. For 2025, MA plans contracted both HMO and PPOs to Reline Financials. MA plans terminated a net 134 HMO PBPs. That's down about 3.2%. PPO PBPs declined on a net basis by 66, down by about 2.5%. HMOs grew by about 480,000 during the 2025 enrollment season, while PPOs contracted by about 58,000. This means that a great deal of PPO lives were impacted and left those products, even if the number of PPO PBPs didn't seem to fall a great deal. Big MA plans and others have begun ending commissions for enrollment in certain plans due to the financial struggles. The median out-of-pocket maximum from 24 to 25 increased by 8%. Supplemental benefits dropped considerably from 24 to 25, including fitness benefits from 98% to 96% of plans, in-home support services from 9% to 6% of plans, meals from 72 to 66% of plans, nutrition services from 40% to 29% of plans, over-the-counter benefits from 86% to 73% of plans, and transportation from 36% to 29% of plans. This is not to say that plans did not invest in some new counties or expand in others. More importantly, plans seem to have a major focus on special needs plans offerings. While individual MA plan offerings declined by 6.54% in 2025, SNP offerings increased 8.5% in 2025. From January 24 to February 2025, SNPs grew to 7.553 million, a gain of about 646,000 or 9.35%. SNP enrollment grew about 264,000 in the 25 enrollment season. SNPs have dominated monthly MA gains in 2025. All this said, in the end, robust competition remained. $0 premiums prevailed, and most enrollees could find very favorable plans in terms of added benefits, reduced cost sharing compared with fee-for-service, and closure of some of the gaps in traditional Medicare benefits. But 2025 represented some seismic changes for both plans and enrollees. As well, national plans had bigger negative impacts than the rest of the MA plan world. The rest of the MA world gained in terms of market share ever so slightly. With that, we will take our last break, and when we come back, we will discuss what to expect in 2026 on retrenchment. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you are enjoying this edition of the Healthcare Labyrinth Podcast. We're talking about what may happen in 2026 to MA benefits, growth, and more. So what is in store for 2026 retrenchment in MA? Some analysts are speculating that contraction of benefits, products, and geographies could be robust again this year. But will it be as big as 2025? We know that United has already said it will seek to shed more than 600,000 lives in 2026 by ending unprofitable plan benefit packages. CVS Health's Aetna reported better financial news after it pulled back in the MA market in 2025, but it is by no means out of the woods yet. Aetna announced it will end nearly 90 Medicare Advantage PBPs across 34 states in 2026. Most are PPOs. Humana has also improved financials with its pullback. Elevance Health has broadly pulled back on marketing, including commission payments. Centene and Molina will see major impacts in Medicaid and the exchanges over time. So it is fair to say that additional benefit, product, and footprint pairings will continue even for these plans. What is the depth of potential reductions? How big the impacts may be depend on a number of things. The 2026 rate hike will be over 5%. Even with the last phase-in of the V28 risk model. But we are seeing major trend in MA. How did plans evaluate the rate increase against expected risk and utilization? Star ratings for 2025 were down for a third year in a row. The 2025 star ratings are used for rate setting and quality bonus payments for 26. Those plans that saw greater star drops are disadvantaged against others and might have to contract more. Are MA plans also being more conservative, or at least less adventurous, due to the huge potential extrapolation penalties that could arise beginning soon due to the 100% RADV audits. The Part D cost-sharing changes from the Inflation Reduction Act continue to roll out and impact plans due to the surging drug utilization and prices. MA plans have eaten a great deal of the cost hikes in the Part D side by massaging other benefits on the Part C side. In addition, the Part D cost hikes also have factored into product and footprint decisions. With the reductions in the special standalone Part D PDP premium stabilization program in 2026, as well as spiking Medicare supplement premiums, will more seniors and people with disabilities decide to abandon the traditional program in favor of MA? What is the risk profile of these folks, and was that being taken into consideration by MA plans as well? Generally, we would expect the continuation of and more commission reductions for specific products, such as PPOs. This will impact enrollment uptake in 2026 as well. Rural hospitals continue to demand high rates and are terminating MA plans. This might have led to contraction in rural markets for 2026. In summary, though, I do not expect the enrollee impacts to reach what we saw in 2025, but we already see big contraction announcements by United and Aetna. The over 600,000 target reduction in membership from United is already about a third of the contraction seen in 2025. So we can say the contraction in benefits, products, and footprint could again be sizable. We will know soon. With that, we will conclude this edition of the Healthcare Labyrinth Podcast. We will see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.